Assalamu alaikum. Let's talk about a very interesting topic called chronic fatigue syndrome. How you can diagnose these chronic fatigue syndrome CFS. It is diagnosed after three months, at least 3 months of disabling fatigue. 3 months of disabling fatigue affecting the mental and the physical function. It affects the mental and physical function more than 50% of the time in the absence of any disease which explain the symptom. So chronic fatigue syndrome, 3 months of disabling fatigue affects the mental and the physical function more than 50% of the time in the absence of other disabling disease. It's if you think about the epidemiology is more common in the female and past psychiatric history has not been shown to be a risk factor. So most common in the female and need not to be past psychiatric history. Fatigue is the central feature. So chronic fatigue syndrome, fatigue is the central feature. And other in here there may be sleep problems, there may be sleep problems, there may be muscle and joint pain, there may be muscle or joint pain, there may be muscle or joint pain, there may be headache, there may be muscle or joint pain, there may be headache, there may be painful lymph node, there may be painful lymph node without enlargement, there may be sore throat and cognitive dysfunction, difficulty in thinking, inability to concentrate, impairment of the short-term memories, difficulty with word findings. There may be physical or mental exertion makes the symptoms worse. There may be general malaise like symptom, dizziness, nausea, and sometimes palpitations. So these are the palpitations. So these are the features you can get a patient with CFS, chronic fatigue syndrome. The features are again first sleep problems, muscle and joint pain. There may be headache. There may be nausea, dizziness, palpitation. There may be nausea, dizziness, and palpitation. There may be nausea, dizziness, and palpitation. There may be sore throat, cognitive dysfunction. There may be sore throat, cognitive dysfunction, sore throat, cognitive dysfunction, or physical or mental exertion, general malaise. In NICE, if you do the investigation, NICE guidelines suggest carrying of a large number of screening blood tests to exclude the pathology, full blood count, urine examination, liver function test, glucose, thyroid function test, ESR, CRP can be done, and calcium, creatine kinase, serum ferritin, and celiac screening should be done. And celiac screening should be done before reaching these diagnosis. And the diagnose management is to refer the specialist safest service if the diagnostic criteria are the met. and symptoms have persisted for more than 3 months. In here, you need to do energy management. That is a self-management strategy that involves a person with um, CFS managing their activities to stay within their energy limit with support from a healthcare professional. And cognitive behavioral therapy, it actually stressed that supportive rather than the curative of the CFS. We can give a graded exercise therapy. It can be recommended by, but now is specifically not recommended. So graded exercise therapy is not recommended nowadays. CBD is the uh, treatment for chronic fatigue syndrome, and this CFS has a better prognosis, and its CFS has better prognosis in children. So that is all about chronic fatigue syndrome. Hope you enjoyed.